has your dentist, your family dentist, or anybody in your family or far off relative who's a dentist has advised you that your kids need to wait before they start orthodontic treatment? Let them turn 11, 12, 13. After that you do treatment. There's no need of going to an orthodontist. There's no need of starting braces until all the permanent teeth have erupted. Well, this is a common narrative, and unfortunately this is wrong. Today in this video I'm going to debunk why this is wrong advice and why you must not wait so long, and what are the new technologies that are available, and if intercepted early, how your kids can benefit. So let's start right away. Hi, I'm Dr. Salman Khan. I'm a dental specialist, orthodontist practicing in the last 15 years here in Bangalore. So I made this video because I get a lot of consults where parents come and tell, doctor, but we used to go to our family dentist every 6 months, 1 year, and he used to tell there's no need to start the treatment right away. He's only 8, he's only 9, let's wait. And by the time they came to my clinic, when he was referred for ortho treatment at the age of 13, 14, already I can see complex malocclusions, complex dental and jaw issues already established, and then they require long treatments. Today, this video is for you. I'll break it down into 4 parts. Number 1, what is early orthodontic treatment? Number 2, why waiting isn't always the right advice? Number 3, which kids should actually start with early orthodontic treatment? And number 4, what are the benefits of starting this treatment early? So without further ado, let's dive into the video. So normally, number 1, what is early orthodontic treatment? This is orthodontic treatment that happens in kids between the age of 6 and 11. I tell by experience that this is golden age where, imagine, the jaw is like butter and orthodontic treatment is like hot knife. So what happens, the orthodontist can just manipulate the jaw, shape the jaw, design the jaw however they want. So if any treatment happens during this phase and age, phase 1, it makes sure that the subsequent phase that comes later, that is phase 2, the treatment will be much easier and short. And sometimes in the phase 1, when correction everything is completely achieved, we can altogether avoid the phase 2 completely. So early orthodontic treatment is not recommended or necessary for every patient, but how do we know whether your child requires early orthodontic treatment or not? Let's find out. So there are various tools that we work with as an orthodontist. We use palatal expanders, we use Invisalign first, we use habit breaking appliances to ensure the child during this phase 1 between the age of 6 and 11 can start phase 1 of orthodontics. And what happens if we wait and if we don't start? Why do I recommend that waiting is always not right? See, if you're waiting in this phase where the child desperately requires treatment, the crowding is going to get worse. Habits like mouth breathing or thumb sucking, if they are there, they're going to make sure the jaw becomes more narrower, the palatal wall develops much deeper, and then it's going to complicate the treatment when we start at the age of 13, 14, mostly requiring premolar extractions. That's what most of the orthodontists do, because the patients come late to them at the age of 13 or 14. At that time, they are not left with any much option and they choose to extract 4 teeth. Apart from all of this crowding getting worse and maybe needing extractions, another problem is children often develop speech and confidence issues. This is something psychological. I have met a lot of kids who are not very confident, who are shy because they look what they perceive as ugly, or sometimes they end up getting bullied in school because of the way they look. When we do phase 1 orthodontic treatment, all of this can be curbed early, and latest technology is today available. We can do a smooth treatment, and by the time they become 10, 11, 12, by the time they enter high school, they already corrected their orthodontic treatment. If not fully corrected, at least 80% of the phase 1 treatment is done, and then the phase 2 will require probably less than 6 months to a years of treatment, and that will make your child more confident, more easy to go to school. I hope you're enjoying what I'm telling. So please don't forget to subscribe to my channel. It helps me motivate to bring out videos, honest advice week on week, especially for you guys, with complete sincerity. Now, which kids should actually start early? The common problems that I see in kids which I advise that they need to go for phase 1 of orthodontics is, number 1, they have narrow arches, they have beak shape appearance, they have crowding, they have thumb sucking habit, they have mouth breathing habit, their crowding is getting worse and worse, they're predominantly mouth breathers. So if you think your child has any of these problems, then I think it's a time, at least even if you don't start orthodontic treatment, get an orthodontist opinion. Get an orthodontist who's doing a lot of phase 1 treatments, because sometimes I meet old school orthodontists and unfortunately even they don't advocate phase 1 treatments. They'll be like, okay, just they dismiss the patients and parents concern. They just tell, okay, you come when the child's 13 14, at that time we will take care of it. So make sure you find the right orthodontist who can advocate early interception and make sure the problem doesn't get more complicated. So what are the real benefits of doing this early treatment? See, number one, it can correct airway problems, breathing pattern problems. It can correct adverse oral habits that can lead to further complications. And if phase 1 is required and done correctly, in phase 2 the treatment time can be reduced, complexity can be reduced, speech issues can be corrected. Your child is much more confident facing camera, facing people, going to school. He won't get bullied, and in the long run probably you will end up avoiding extractions, and most importantly you will end up saving cost as well, because phase 1 everything was done very preventively, very conservatively, and that way we did not have to elaborately plan long 3-year 4-year comprehensive orthodontic treatments later on in life. So just remember, we are not rushing here to do orthodontic treatment. We are just making that small opportunity window of the child's growth where I can modify the jaw as per my will and wish. Before that window closes, generally the best age is between 6 and 11 and 12. Up to 13 also sometimes you can do, but I would recommend the right age is between, let's say, 7 or 8 up to 11. That's the right window for me to do an effective Invisalign first kind of orthodontic treatment or preventive orthodontic treatment. So if your child is between 6 to 10 years of age and you're curious about orthodontic treatment and you see any of these signs, don't be worried. Get an orthodontic screening done by an orthodontist who's close to you or someone who you could find locally in your area wherever you're residing. And if you're a parent, don't wait for the baby teeth of your child to fall and then only I will start orthodontic treatment. No, that's not right. Just get it assessed and get the orthodontist expert opinion. And if you're wondering, you may see some ads that there's Invisalign First and there is Invisalign. So Invisalign First is dedicatedly for kids. What is the difference between Invisalign First and Invisalign? How are they different? Next video, if you're interested, I'm going to come out next week with specific differences between these two products and how they help Invisalign First, especially for kids, and starting early could be really beneficial. We will discuss that in next video. Until then, keep watching my videos. Goodbye.